Welcome to Long COVID Doctor, an educational series for sufferers of long COVID. I'm Dr. Tim Robinson, formerly a GP for 30 years, now GP lead for 3 NHS long COVID clinics and a NHS GP clinical lead in long COVID across southwest England. This episode is on acceptance and commitment training. I hope you find it interesting. So, imagine that you have had long COVID for 3 years. This will be familiar to many of you. Your symptoms are fatigue, breathlessness, brain fog, disturbed sleep, headaches, palpitations, joint pains. And you have tried vitamins and supplements through your extensive reading of social media postings and Googling. You've been to the long COVID clinic, you've learnt pacing and planning, and you know your energy envelope. You may have been seen by MECFS services, or perhaps even mental health services. But you are not better 3 years later. You are still fighting it. You still believe that you can defeat it, even if mainstream medicine doesn't have a cure. You're still keen to do anything to help. You have heard about acceptance, commitment, training, maybe. And you wonder if it can help. You wonder if it is just another thing that won't help. You're suspicious that it sounds a bit, maybe airy-fairy, a bit waffly, just another type of talking therapy. You wonder if it will just give you false hope. But you are at a point where you are despairing and desperate. You feel that you have nothing to lose. And so you sign up to acceptance and commitment training. But what are you signing up to? That is the question. So, acceptance and commitment training for long COVID. Basically, acceptance and commitment training is abbreviated to ACT. Patients with long COVID who have had ACT, and I'll refer to it as ACT from now on for easiness sake. Patients with long COVID who have had ACT are reporting benefits when combined with other strategies necessary to aid recovery from long COVID. ACT. Basically, ACT helps patients accept their condition. ACT helps patients accept that recovery takes time. ACT helps patients come to terms with long COVID while they apply all the advice and guidance from the long COVID services: pacing, breath control, healthy diet, sleep hygiene, symptom control from the health professionals. ACT hopes to help patients gain control of their condition and its symptoms, rather than the condition and symptoms being in control of the patient. We can't change what has happened, but we can change how we think about it. ACT is purely a training strategy to help with acceptance. Patients with long COVID have a choice between how they view their situation. They may dwell on the worries, the despair, sadness or anger about long COVID, having long COVID. Or they may commit to a more proactive, accepting approach. The latter is the goal behind acceptance and commitment training. So, before I explain ACT further, it is extremely important to state the following. By considering acceptance and commitment training as an approach to undertake, does not mean that we have given up on the mission of defeating long COVID. It should be seen as an additional way of helping, while you continue with all the advice and guidance offered by the long COVID services, as I said earlier. Equally, it must be made clear that by considering ACT, we are not dismissing or attributing long COVID as an imaginary mental condition. We are not psychologizing the condition, i.e. calling it a psychological condition. Our understanding of long COVID as a multi-causal, multi-system condition whose effects can be measured and backed up by tests and MRI imaging, for example, clearly demonstrates it is a physical condition. It is physical in nature. There is no disputing this. Long COVID is most certainly not, and I repeat, not all in the head. Currently, the widely adopted approach to illness has shifted from biomedical to the biopsychosocial model. Any chronic, debilitating, multi-system condition, such as long COVID, will inevitably impact on mental well-being, with a range of reactions such as worry, fear, sadness, anger, and despair. Strategies that address those understandable reactions to long COVID will aid the body's natural healing processes to bring about physical recovery from long COVID. This is the reason acceptance and commitment training should be considered to be used alongside those other strategies, as I've said before, recommended by the long COVID services. Having explained the objective of ACT and the context in which it should be applied, a fuller explanation of ACT is needed. So, acceptance and commitment training, as stated earlier, is abbreviated to ACT. And now, for a full explanation of those three words with regard to the process is as follows. So, A stands for acceptance of your thoughts and feelings. C stands for commit to an action in line with your values and principles. And T stands for take action in line with those values and principles. Formal acceptance and commitment training is composed of 6 facets in stepwise numerical order. What follows here and now, is an overview of that process, the process of ACT, that I have slightly adapted and made relevant for people affected by long COVID. The purpose of this overview is to introduce you to the concept of acceptance and commitment. Hopefully you will find it interesting and be encouraged to consider it. As stated earlier, this is an adaptation of the formal ACT course that I have divided into 5 sections in numerical order. So, sit back and listen and see what you make of it. Section 1, entitled Here and Now. The here and now. Not the past, not the future. Focus on the present moment. Become aware of the present moment now. Be aware with openness and flexibility and curiosity, like an innocent child. Not in the past, with sadness and regrets, maybe feeling depressed. Not in the future, with worries and uncertainties, maybe having anxiety. Blank out the past, the future thoughts and worries. Shut them out Focus on the now, the present moment now. Shut them down. Rest the brain. Time out. Flush to refresh. Focus on the now. And be aware of the now by being mindful. Be mindful of the moment now. Mindful of now. Access mindful awareness by doing mindful breathing. Mindfulness breathing, we call it. So you can close your eyes, focus on your breath, in and out. Slowly breathe in, slowly breathe out. Push your tummy out when you breathe in. A long deep breath in. Pull your tummy in as you breathe out. A long breath out. Slowly breathe in, slowly breathe out. Keep going for 3, 4, 5, 13, 20 minutes. Sit comfortably in a quiet place. Repeat this daily, preferably twice daily. That is mindful breathing. That is mindfulness. Whilst you're doing this, if a thought pops into your mind, a distracting thought, while doing your mindful breathing, don't worry about it. Log it, acknowledge it, then let it go. And bring yourself back. Return to your mindful breathing. Focus on the breathing, your mindfulness breathing, your mindfulness. You are now living in the present moment, the here and now. You are aware of the present moment, here and now. Section 2, entitled Blue Sky. And so, think back to when you were well, when you had your happy, fulfilling life. Think back to before COVID, before long COVID. Remember what life was like. Remember what made you happy, content, fulfilled. Remember the love of your loved ones, your family, your friends, your workmates. Remember the pleasures and laughter, what you enjoyed, who, where, when you enjoyed life, and how you lived your life with your values and your principles. Those were the values and principles that your pure self, what you are, what you stand for, what you believe in, values and principles like connection, caring, contribution, curiosity. Think of them as clear blue sky. Picture that. See yourself and what happens. See yourself and what makes you happy as clear blue sky, cloudless, clear blue sky, permanent, stable. The positivity and goodness and happiness of clear blue sky. Remember that before COVID, you had positivity and happiness. Life was like clear blue sky. Section 3, entitled Dark Clouds. And so, all was well. You were happy, fulfilled. Everything was like clear blue sky. And then it hit you, COVID. And you didn't get better. You got long COVID. And that was 3 years ago. Your clear blue sky, positivity, was snuffed out. It became blanked out by clouds, negativity. You became worried, frightened, frustrated, worried that you are not getting better, worried that you'll never get better, worried about your symptoms, such as palpitations, asking yourself, are they due to heart damage? Am I going to die? Worried about the effect this is having on your family. Worried that you will lose your job, not be able to do your job, lose your income, your house. Worried what the eventual outcome will be. Will you get better fully, partially? Or is it like this, forever after? With all your hopes and dreams smashed, frustrated with the setbacks, the crashes, frustrated that all the treatments tried have not really made any difference. Frustrated that medical science is failing you. Frustrated that despite being strict on yourself and doing everything that the long COVID services have taught you, you are not getting better. Frustrated that people don't believe you, as there's nothing to show for it. Hating feeling dependent on others. Hating feeling a failure. Hating sympathy and pity. Frightened that you will never get better. Desperation and despair. You feel like a broken person, sort of worthless, useless, dependent. You feel like shutting down and giving up. What's the point? You feel depressed. These feelings of despair, desperation, depression, the broken person, haunt you. You're hooked on them. You can't let go of them. You're fused with them. They're always there. They're dominating you. They overcome you. They become you. Those negative thoughts. Those clouds that are blocking out the clear blue sky. The clouds are always there. Grey, overcast. Maybe for brief moments, drifting and allowing you a glimpse of blue, but mostly blocking the blue. And at times, dark storm clouds, oppressive and black. Think of all those negative thoughts about long COVID as clouds, blocking out the clear blue sky. Those thoughts of despair, desperation, and sadness and depression are dark clouds blocking the blue sky. The negative blocking out the positive. Dark clouds. Section 4, entitled, It's Time to Accept. And so, you see the negative dark clouds blocking the positive blue sky. You see the dark clouds as those dark feelings of despair, desperation and depression. You want to release, detach, let go of the negative dark cloud thoughts. You want to replace them with positive blue sky thoughts. To do this, you must see those dark, negative cloud thoughts as only thoughts. Nothing more, nothing less than thoughts. Think of those thoughts as clouds. And know that clouds are not fixed. They're not permanent. They come and go. They can pass. And how can you move those clouds? Shift the negative dark clouds. How can you do that? To reveal the positive blue sky thoughts. The blue sky, that is you, the happy you. You must accept and believe that those thoughts are indeed just thoughts. The despair, the desperation and depression are real, but they are not helping you. It would be lovely if you could let them go. What will help to let those negative thoughts go? You've reached the point where you need to accept. Acceptance of the situation, the long COVID, the effect it has had on your life, how it has robbed you of your life. Accept that it has happened. Accept that it is what you have. Accept that you have been unlucky. But be grateful that it could be worse. Be grateful that you're still alive. That you still have family and friends who care for you, who value you, love you, remember you for what and who you were. Give it time to pass, time for your body to heal and mend naturally, time for your body to rebalance, to return to harmony. Give it time for the medical world to continue the search for a treatment, cure, and greater understanding of long COVID. Look after yourself. Eat healthily. Structure your daily activities and nighttime sleep. Use all the advice you have been given by the long COVID service. Go slowly and know your energy limits. Don't beat yourself up. It's not your fault. It's bad luck. Be kind to yourself. Show yourself some self-compassion. Praise yourself when you achieve a goal. And so, accepting the long COVID for what it is, being grateful that it's not worse than it is, not fighting it, and giving it time, and looking after yourself. Armed with these in mind, you are now ready to go forward with a more positive outlook, with a plan, the tools to clear away the negative thoughts of long COVID, the negative thoughts that long COVID has given you, to clear away those negative dark clouds, to uncover the clear blue sky, the positivity. Section 5, entitled, It's Time to Act. And so, to clear away the dark clouds, to reveal the clear blue sky, you need a plan. The tools, actions to learn and commit to, a plan of attack, an action plan. And so from this moment onwards, as soon as you find yourself thinking about all your long COVID, despair, desperation, depression, those negative long COVID thoughts, think of this 3-step action plan. The 3-step action plan, the AAA plan. The first A stands for alarm. And the alarm is, say stop. I'm having a negative long COVID thought. The dark clouds are there. Dark clouds. Say stop. That's your action. The second A stands for ask. And ask, what do I want? And you say, to clear the clouds. That's what you ask. You want to say, to clear the clouds. And the third A, and what does that stand for? Action. Think now. Focus on this moment now. Be aware outside and inside. Outside of us and inside of us. Be aware with openness, flexibility and curiosity. Think now. Mindful breathing. Slowly in, slowly out. Those breaths that push away the clouds. The dark clouds are gone. The blue sky is here. Only clear blue sky. Blue sky. With blue sky, you are clear in your mind, your thinking, your feelings, yourself, your condition, your outlook. With blue sky, positivity, you are accepting of your long COVID. Grateful for what you have, not fighting it, but giving it time. Looking after yourself. With blue sky, you are in control of your long COVID. Your long COVID is not in control of you. So remember the plan of attack. Remember the AAA plan. Alarm, ask, action. Alarm, standing for stop. The clouds are back. Say, stop. Ask, what do you want? You want to clear those clouds, don't you? And action, say, here and now. Focus on the moment now. Be aware of now. Be open, flexible, curious. See the clear blue sky and proceed. And breathe slowly in and slowly out. That is ACT. Acceptance, commitment, training. An overview of ACT. Hopefully you found it made sense, explained in a way that was easy to understand and straightforward. As explained at the outset, undertaking ACT does not mean that we consider long COVID to be all in the head. We have not given up on our quest to defeat it with treatments. It is not a fob off. ACT is not a fob off. Undertaking ACT is purely a way of aiding natural healing, acknowledging the concept of mind-body connection and balance, and to restore harmony and well-being. Hopefully this overview will encourage long COVID sufferers to consider acceptance and commitment training as an additional part of their recovery from long COVID. So there it is. I hope you found that helpful. Cheerio.